You had him.
He was on time.
Had good lunch with your dad down there. He was talking. I think he's tired of being cooped up.
I thought he is too.
Okay, we're ready.
All right. Good afternoon, ladies and gentlemen, and welcome to this Monday, July 6th public meeting of the Board of Garrett County Commissioners. Want to welcome everybody tuning in, and this is our first meeting back together in the courthouse as we try to reopen things here and get back to normal in some way, shape, or form. I now call this meeting to order. Mr. Knoll, are there any additions, corrections, or deletions of the public meeting agenda?
No, sir, there are not.
Hearing none, is there a motion to approve the meeting agenda?
So moved.
We have a motion, we have a second.
Second.
The agenda is approved by mutual consent. Everybody got a copy of the minutes in advance of the meeting? Are there any questions, additions, or corrections to the minutes? Hearing none, do we have a motion to approve the minutes?
Motion to approve.
We have a motion, we have a second.
Second.
Motion is second, meeting or minutes are approved by mutual consent. We are joined by Bob Stevens here today from the Health Department. I see he's on a call right now. That's all right. I'm going to bypass him here to start to give him some more time. And we do have some appointments and reappointments we'll go to in the agenda. Mr. Knoll, what do we have for the Garrett County Mental Health Advisory Committee?
Yes, sir. We have appointments for a 3-year term for the Mental Health Advisory Commission. They are Leah Turner, Teresa Friend, Scott Alexander, Amy Fike, Sarah Cockerham, Lisa Lewis, Carrie DeSimone, Sabrina Tasker, Regina Gearhart, Corey Shrives, and Kathy Schrock. All have agreed to serve for a 3-year term.
All right, and we'll take both of these at the same time unless there's any objection or concerns. We also have appointments to the Deep Creek Watershed Board of Zoning Appeals.
Yes, these are 3-year terms. So we have Bill Swift and Robert Hoffman, and both of them have agreed to serve.
Okay, any
Bill Ingram.
Bill Ingram and Russell Signs are currently on the board, and their term will continue.
any other questions for Mr. Knoll on the appointments to Garrett County Mental Health Advisory Committee or the Deep Creek Watershed Board of Zoning Appeals? Hearing none, do we have a motion to accept the slate of recommendations for both committees?
So moved.
We have a motion, we have a second.
Second.
Question on the motion? All those in favor say aye.
Aye.
Opposed? Motion carries. Thank you. Next item on the agenda, we have a road name resolution. Garrett County Department of Planning and Land Management for Blue Mountain View. Mr. Knoll, any information on that?
And so this will be a new name for a development. And it's a new road, so there's no other comments on it.
All right, so the new road going to be called Blue Mountain View. Any questions at all? So the resolution reads, whereas the Board of County Commissioners of Garrett County has formally adopted the Garrett County address ordinance as the initial step to enhance the 911 system. The ordinance requires the establishment of Garrett County Road Name Index that shall include the names of all streets and roads within the county. The Board of County Commissioners have duly adopted said Garrett County Road Name Index, and therefore be it resolved, the Board of County Commissioners of Garrett County does hereby adopt the following changes to road names in Garrett County to be included in the road name index. Tax map 49, former name not applicable, new name Blue Mountain View. Do we have a motion to accept resolution number RN 20-2 to that effect.
Motion to accept.
We have a motion, we have a second.
Second.
Motion and a second to adopt Blue Mountain View Road. Any question on the motion? All those in favor say aye.
Aye.
Opposed? Motion carries. Now I see Bob is available, and thanks for finding the time. I know you've been very busy. I'll turn it over to you so that you can give us an update on what's happening in the county from the health perspective.
Okay, good afternoon, gentlemen. Thanks for inviting me to the meeting. From the health perspective, I'll just give you a couple of things. Obviously, COVID is at the forefront of everybody's concerns right now. We have, to date, we have tested 2,816 people, tests have been given in the county. And so far, all but 15 have come back negative. So we have 15 positive cases. If you look at that, that means that we have about 49 people per 100,000 are positive. To give you a perspective, Allegheny County is the next lowest per 100,000, and they are at 295 per 100,000, and the state is somewhere around 900 per 100,000. So we're well below that. We are beginning to see a lot of compliance issues that our phones are, we're getting lots of calls, lots of emails regarding social distancing, and also with regard to face covering orders, folks not going by the rules of the road, so to speak. And we try to follow up on those as best we can. However, you know, we don't have any extra staff to do that. And so we are trying to follow as much as possible. But the reason why I bring that up is that I think one of the things that we would really like the help of the community with is to, when they see an issue, that they would also complain to either the store manager, the owner, you know, write a review on their social media, or let people know that if a business is not enforcing that order, that they may be losing your business, because I think that really hits people a little more than for us to go in and try to make those compliance checks. We're doing that, and Maryland State Police, as they have time, they're trying to do the compliance checks, but we're really running into a lot of issues with that. I would like to say that we, with the testing, you know, we are really trying to do more testing in the community. And last Friday, we tested at the fairgrounds. We had 267 people who were tested. Of those, 200 were from Maryland. And I have my data here. I got all confused when I was having problems with the video. 170 of those people were from Garrett County. So really, when the results come back in, it'll look like we only did 170. We're still waiting for the University of Maryland to give us the lab results. There's been a backup nationwide of labs because they were getting out in a more timely fashion, but because of the resurgence in 35 states across the country, there's a whole lot more testing going on. And so that's really taxing the system. And so the results aren't coming back in time like we would like them to. As I mentioned, there's a lot of other things that we're continuing to do here at the health department. In addition to COVID, obviously our home health, behavioral health, our dental clinic, WIC, all those programs are open and seeing people. They might be seeing people virtually, some of that, and some of those are where people are not coming in the building, but we are trying to provide all the services that we had prior to COVID is being provided. Many of those are by appointment. I would say that you know, when we look at the fact that we're in the middle of this pandemic, one of the things that we know is that we also had this epidemic, which was before COVID came along, and that was with drug abuse and drug overdoses. And it's sad to say, but we have this year so far we've had 7 overdoses in Garrett County, and that's on track to be the worst year ever. Nearly all of them were in March, April, and May, and so we're really trying to do what we can to prevent that. A lot of that has to do, I think, with the social isolation that people have, and also the fact that the drugs that are out on the street that are being sold are so much more potent because of the fentanyl that's being mixed in with every other drug that's out there, and so we're seeing a lot more overdoses, and that's similar to around other rural communities around the country. Another thing, just from a surveillance standpoint, just to let you all know that we did have our first positive rabies case. So rabies is here, and we're going to continue to follow up on that. I don't know if you have other questions you would like to ask.
The 7 overdoses, were they deaths or just overdose?
Oh, those were overdose deaths. And so the number of overdoses in the county that we see that get reported, those are also up. I believe last month in June there were 10 overdoses that were seen at Garrett Regional. Of course, you don't see all the overdoses because some people are being transferred to other hospitals. There are some people that they get Narcan and they refuse transport and that sort of thing. So those numbers are definitely up.
Thank you.
All right, any other questions for Bob? Anything else you got for us, Bob?
Not at this time, but I'm sure that all of you are getting complaints regarding different businesses that do not seem like they're enforcing some of the precautions for COVID. And again, we're trying the best we can. There's a lot of misinformation. There's one of the problems that we have here is that West Virginia does not have a face mask order, although the Governor Justice has said that he is considering that. Honestly, if West Virginia would have a face mask order, it would make our job a whole lot easier, because whenever people are coming into Garrett County from other areas, they don't see the consistency. They hit here and they think, well, I don't have to do this back home, so this shouldn't apply to me here. And so, and that just creates more of an issue.
Bob, would you like to mention the community testing for next week?
We do have testing. We do have more surveillance testing. And I'm glad you brought that up. That's on July 17th. That will be in the parking lot adjacent to the health department. It's below Mountain Laurel, and it's in our parking lot. So it's the parking lot on the side. And that testing that we will be using state kits, and that's for anybody who's interested in being tested. They can be tested. There's no charge to that. That will be from 7 to 1 is what we planned for that. And so we wanted to do that 2 weeks after the 4th, because generally the incubation period for coronavirus is 7 to 10 days. And so we wanted to see if there's if we begin to see more people who are asymptomatic who are testing positive in the county, to see if there's a spread that as a result of just a lot more of the activity that's happening here.
All right, anything else? Well, thank you very much, Bob. And as we've said a million times, we really appreciate all you're doing during this time. We know your office is very busy.
Well, thank you, and sorry for the technical difficulties. This platform, it worked with the other platform earlier today. I think I was on a call with Commissioner Edwards earlier today, and it worked like a dream. But with this setup, it just didn't work this time. So hopefully next time we'll be able to make it work.
All right. Thank you, sir.
Okay, thank you.
All right. Next item on the agenda is some purchasing recommendations and some bid awards. Brian Bowers, what do you got for us?
Good afternoon, gentlemen. I have 5 agenda items for your consideration today. The first of which is an annual fiscal year term contract for hot mix asphalt. The county accepted bids on the asphalt on May 21st. We did receive a total of 3 responses. Just like the crushed stone and the winter abrasives, we are recommending awarding pricing or contracts to all 3 vendors. That's Keystone Lime, Belt Paving, and IA Construction for all 3 types of hot mix asphalt that were bid. Again, it would determine where the project is in terms of paving, so where the roads department purchases the asphalt. And there's a formula and everything built in the bid, just like the other ones I mentioned. Do you have any questions for me for this one?
We're gonna do these all together.
Yeah, we'll take them all, but is there any questions on the hot mix asphalt? All right, we'll take the next one then.
Okay, the next one is also a fiscal year term contract for the roads department. This is for chain and augers. We accepted bids back on May 17th, got a total of 2 responses. One was actually a late bid and we deemed as non-responsive. So it really narrowed it down to 1. The recommendation is to award the bid to just Chemung Supply Corp. There are various sizes and types of chain that we were awarding to them, all priced by the box pretty much. Again, this is July 1st through June 30th of 2021, the contract term. Any questions on that one?
No.
Okay, the next bid award is for a construction project. This is the Deep Creek Lake Shoreline Erosion Reduction Project. It was bid back on May 21st. We got a total of 4 bids. This is to reduce shoreline erosion in the Silver Tree Cove. It's about 520 linear feet of shoreline that the DNR is helping us with through a grant. So it was our responsibility to bid it out. As I mentioned, I bid it out. We got 4 bids. The recommendation is to award the bid to Downstream Strategies, LLC, a total bid price of $148,032, which includes bonding costs. So when we bid this, we bid it as design and we also bid it as permitting and construction. So that's why you're seeing the bond, because it threw it over that $100,000 with construction mixed in. We didn't have a choice. By law, we have to have performance and payment bonds. The project completion is 540 calendar days from the notice to proceed. Downstream Strategies is partnering with Highland Engineering and Surveying for this project. Again, it is 100% grant funded through the Maryland Department of Natural Resources. We did get current concurrence and award from them. We received that on June 24th, so we're ready to get the project moving. The low bid on this project when we opened them was Ecotone Inc., but they submitted a conditional or qualified bid where their bid price was based on 230 linear feet of stabilization as opposed to 520. So the awarding of this contract also includes the recommendation to reject the bid from Ecotone. Any questions on that?
No, go ahead.
Okay, moving on. The next bid award is for construction project is for Alvelton Community Center bathroom construction project. Alvelton's wanting to construct an exterior restroom there at their facility with POS money. We accepted bids back on May 21st, received a total of 3 responses. The recommendation is to award the construction contract to White Horse Woodworks, a bid price of $34,800, 90 days for completion from the notice to proceed. There were some out alternates that we bid because I wasn't sure budget-wise whether we were going to hit the budget mark. So they didn't have enough money to fund those out alternates. So this recommendation includes the rejection of those. So there is the funding, as I mentioned earlier, is program open space. So the amount of funding for the project and POS money is $32,926.50. That does leave a difference of around $1,873.50 that the Alvaton Community Association has committed to pay, or we might be able to find a way to value engineer something during construction to make up that small difference. Just want you to be aware of that they are on the hook and realize that if the full contract amount is the $34,800, that they need to pay that amount plus their 10% for the POS funding. And the final bid award today, this is for Codgers Ridge Water Storage Tank bid. Bids for this project were accepted on April 9th. We received a total of 7 bids. The recommendation is to award a contract to Carl Bell Inc. The total bid price, so there's a unit bid price of $806,000, and there's some contingent bid items that add up to make a total of $824,162.50. We're not anticipating needing to use all those contingent items, but we need to go ahead and proceed with awarding them. Contract completion is 270 calendar days from the notice to proceed. I had in here that the recommendation is contingent upon Maryland Department of the Environment concurrence and award. I did receive that. I did not forward that on to you because I just received it late last week. So we did get the confirmation on June 29th. MDE has committed the funding for the project. So there is a combination of funding for Maryland Department of Environment, ARC, which is administered through Maryland DHCD and the county. So there's $841,799 to cover this project. The only hiccup that we have at this point, we can go ahead and get it awarded, but because the funding's through MDE, it does have to be approved by the Maryland Department, the Maryland Board of Public Works. It's going to be on their agenda, I'm assuming in July, for that to happen. So the county can't issue a notice to proceed or have a pre-construction meeting until that happens. So I just wanted you to be aware of that. We can move on and get all the paperwork in place, but that we need to check that box yet before we can give them notice to proceed. Any questions on that?
Okay, any questions at all for Brian on any of the bids? Hearing none, I'll entertain a motion to accept bid number 20-0521HM, bid number 20-0528CA, bid number 20-0521D, bid number 20-0521A, and bid number 20-0409 as recommended by Mr. Bowers in the purchasing department. Do I have a motion?
Make a motion to accept them all.
All right, we have a motion. We have a second.
Second.
Motion, a second. Question on motion. All those in favor say aye.
Aye.
Opposed, motion carries. Thank you very much, Brian. Appreciate all your work on this.
Thank you, gentlemen.
Thanks, Brian.
Thanks.
Okay, that's the end of the business part of the agenda. I do want to remind everybody that we are taking comments at gccomments@garrettcounty.org. We received a couple. We did get a few a couple days ago in relation to, one of them was about the comprehensive plan. A good question about where we are with that. We've done some focus groups, and when Debbie Carpenter was with us, she was in the community with consultants, and I know they did some public meetings. The Planning Commission has been reviewing, up until March, the Planning Commission had been reviewing some of the draft chapters of the updated comprehensive plan. All of those comments have now been forwarded on to the consultant, ACOM. Unfortunately, Debbie left us to take another job downstate, so that slowed us down a little bit. COVID set in and slowed down our consultant. So they still have some work to do, but we've been slowed down with that. We're hoping to have a draft final review in August and then move forward. So everything's still on track. We just got slowed down by a couple of items. That was a good question. Also, there was a question about the status of the first-time home buyers program. If many people that have attended our meetings and follow us know that several years ago, this Board of Commissioners implemented the Pathway to Home Ownership program with community action. We funded several $100,000 in that over that time frame, including FY20, which just came to a close. This year, FY21, that we just started, due to the budget constraints and certainly COVID and the uncertainty with everything that's there, the county is not participating this year in that endeavor, although the state does have, the state maintains their first-time home buyers program. And everyone that was in queue and approved for our program has been funded through community action. And people knew that that were applying knew that we weren't going to fund that this coming year, although the state program is still in effect, and certainly encourage people to look at that if they're looking to buy a home and work with community action for that or a local bank. Both good questions. And again, if you have questions or comments, you can send them to Garrett County Comments, and we'll do our best to answer them. Does anybody have any other comments or anything else for the meeting? All right, hearing none, our next meeting will be Tuesday, July the 21st. And we hope everybody out there stays safe. And do I have a motion to adjourn?
So moved.
Meeting adjourned. Thank you.